Mental health, we have a lot of mental challenges in Somalia. A decade of conflict has created severe trauma leading to high rate of PTSD and depression into the community. Also, widely spread of chewing cud and using other substances deepen the social stigma, and also the critical shortage of mental health facilities increase the burden of mental illness into the population.
في ظل الأوضاع الإنسانية اللي بيعيشها السودان بعد الحروب المتتالية عليه والنزاعات بين الأطراف المتنازعة، حالياً بنواجه صعوبات في تردي الخدمات ما يختص بالصحة النفسية وتردي في الموارد المتعلقة بالكوادر المساعدة في تقديم خدمات الصحة النفسية.
في شغلنا في مجال الطب النفسي في ليبيا لاحظنا مؤخراً تزايد عدد الحالات النفسية بأنواعها، سواء الحالات الذهنية أو الحالات العصابية، مما خلانا نتساءل ما سبب هذه الأمراض وكيف تزايدت في الأيام الأخيرة.
Help us directly partner with the community leader to reduce stigma and to improve patients' dignity and rights.
وجود خط مشترك في إنه نقدر ننفذ أو تطبيق عملي في دعم الخطط والاستراتيجيات والخروج بتوصيات بأدلة وبراهين بتساعد على إننا تقوية النظام الصحي في السودان.
مهارات تجميع البيانات ومهارات تحليلها وكيفية التدخل وكيفية يعني الاستفادة من هذه البيانات في مجال الصحة النفسية.
Currently, we have 150 million people that are living with mental health condition, especially our young people. So we need to make sure that we have epidemiologists that have the capacity to collect, interpret, and use data to build evidence-based system for mental health. And that's why we are relying on a proven strategies. That's the Field Epidemiology Training Program that have given the continent the right cadre of people with skills and competence to better prepare our country to respond to infectious disease outbreak. And for the non-communicable disease, but especially the mental health, we are using the same proven strategy, the Field Epidemiology Training Program, that combines both theoretical and field work to really improve the capacity of our workforce to use public health tools, strengthen surveillance to better respond to mental health challenges on the continent.
The Regional Intermediate FETP Mental Health Program is a competency-based program of a 9 to 12 months duration. The program builds on the established model of field epidemiology training programs, which is majority of field work. The program employs a blend of self-paced learning, live sessions, in-person workshops, in addition to the predominant component of the fieldwork. Looking ahead, we are looking to expand the program more, developing more tiers, particularly frontline tiers, reaching more countries, and build mental health leaders and mentors.